I had no idea that my drinking alcohol would affect my baby's ability to speak.
The month before you knew you were pregnant, how much wine, beer, liquor did you drink?
Maybe a cup of wine every week.
I'd like to make a referral to this public health nurse.
You said they're not going to charge me?
No, this is absolutely free.
Okay.
Okay, it won't cost you anything.
Okay.
So we'll go ahead and proceed with the referral.
Okay.
One of the things that your doctor had passed on to me is that you had indicated that you drank alcohol during the first part of your pregnancy and now just a little bit once or twice a week. Is that?
That's correct.
Okay.
Only once or twice. I just didn't know it would harm my baby.
Okay. I'd like to share some information with you, if that's okay,
Yes, please.
about alcohol use in pregnancy. So this is a booklet that has been put together by a physician who is specializing in dealing with children who've been exposed to different substances. I'm going to turn to the page on alcohol use. This is really nice because it will explain to you the effects on mom and why we're concerned about you. So what we know with moms that are drinking alcohol is that it can lead to some poor judgment. We all know that even just with diet. We eat the wrong things after we've had a drink or two. Poor eating, and then accidents also. The effects that we see on the baby are too small at birth. The baby can have a small brain and have brain damage. There can be heart problems, kidney problems, malformations, and changes in the face. Sometimes you don't notice any of those things when your baby's born. What we know is the research that has been done shows that when a child gets into school, so not in their preschool years necessarily, but definitely we see it when they get into school, the problems with learning. So we can see anything from mental retardation to learning problems.
A New Start for Mom is a certified perinatal drug and alcohol treatment. We work with women who are pregnant and want to deliver a healthy baby, or women who have just given birth to a baby who want to keep on that track of being drug-free. But all women are able to come here, especially if they have a problem with alcohol, drugs, and have children. We encourage them to be here. Our goal is to address the whole person, not just the addiction, but the mind and the body. Because we are a full service treatment program, we deal with life problems because most people start drinking or using drugs because they don't have the skills to live life on life's terms.
And then started self-medicating on pain meds, thinking, well, they're prescribed, so they're okay. And then I started mixing it with drinks, and after a few years, I knew, I had enough sense to know that I had a problem. One thing led to another, and I was introduced to meth, and that's the only thing that made me feel better. So I thought, well, you know, I'm getting up and I'm taking care of the kids. Shortly after I was introduced to meth, my kids were taken. I ended up in jail. I lost my home, I lost my career, I lost my children, and my family fell apart. And then I got out of jail, and one of the objectives that I had to fulfill to get my children back was to take an outpatient rehab. Going through the New Start for Moms program opened up a whole new world that I never knew existed for me. I learned relapse prevention. First, I learned that I had a disease, that if I didn't deal with the issues of the past, then I was never going to move forward. Some of the things that I did in the New Start for Moms program is I got one-on-one counseling with one of the therapists here, and I was able to talk about different issues that maybe I didn't want to share in a group. Also, we had assignments that we did every week on parenting and anger management. They held us accountable by random drug testing. Thanks to community organizations, especially for me, would be New Start for Moms. I am clean and sober 4 years now, and I'm giving back to the very same community that gave me what I have today, which is my sobriety, my children, and my faith.
Almost 20% of babies born in Ventura County have been exposed to alcohol, tobacco, or drugs at some point during pregnancy.
No amount of alcohol is safe during pregnancy.
The damage to the brain caused by alcohol is permanent.
There are people out there who care about you and your baby. Call Ventura County Public Health for resources and support at 805-981-5115.